The other day, I was thinking about my daughter. She recently played in a community symphony. She's an oboe performer. Now, I can remember when she was young and she decided that she wanted to take up playing the oboe. When she started, there was a period of time when we kept thinking to ourselves, like, why is the dryer broken? Well, it was just her 10-year-old self trying to master that infinitely hard double reeded instrument. And now she's gone on to become a music teacher, and I get to hear her play as she's matured into this beautiful performer in symphonies and orchestras. But imagine trying to perform a symphony with no conductor, missing your sheet music, and instruments that don't quite sync up. Much like middle school band, this is what running an AI project without the right tech stack feels like. Hi, I'm Teresa Younkin. I'm a healthcare informaticist, and you'll find me here each week talking about AI, FHIR, and healthcare. Today, we're demystifying what it really takes to orchestrate a successful AI project in healthcare. Well, an AI stack, it's a full set of technologies, tools, and frameworks that we need to work in harmony to move your project from concept to a real-world value. The AI tech stack is that full set of technologies, the tools, the frameworks that we need to work in harmony to move the projects that we're working on from concept to real-world value. And in healthcare, those stakes are high because we're talking about lives, not likes. That's what's on the line. So let's break down what this tech stack looks like. I'm going to use an orchestra analogy for this one. So first of all, we've got the sheet music. That's the data foundation. And just like every orchestra needs sheet music, in AI, this is your data. It has to be clean. It has to be structured, accessible to everybody. And healthcare data lives in silos, right? We know it lives in the EHRs, claim systems, pharmacy systems. And if that data is messy, outdated, or biased, your AI is going to play the wrong tune. And IBM reports that poor data quality still remains the top barrier to AI success because organizations are not taking that 80% of the time to clean the data and to organize it before they even begin that model training. The next part that you're going to need are your musicians. Now, those are your models and your algorithms. Musicians interpret the sheet music. And in AI, these are your machine learning models. They're trained to spot patterns, to predict outcomes, and to support decisions. But even a virtuoso musician needs the right instruments. And that brings us to the instruments. And those are your infrastructure and your tools. So this would include your cloud environments like a Microsoft Azure or AWS, the data pipelines and your tools. You're going to be using things like PyTorch or TensorFlow. In healthcare, we also use tools like Smart on FHIR because we have to be interoperable. It's no longer optional, right? It's required, even by law. 95% of executives, according to Accenture, say that cloud infrastructure is critical for scaling those AI solutions. The next thing that we're going to need, the conductor. Who's bringing all this together? Your conductor is your AI governance and that human oversight, because no orchestra can perform without a conductor, and no AI project should run without governance. And that means the privacy policies, your bias mitigations, your clinical validations, and you need to have very clear rules for accountability. This is where most projects fall apart, and I've talked about this before. Even before AI, CMS understood this, and they put out things like the information blocking rule and HDI1 and HDI2 and all these new RFIs that are coming out. Everybody is stressing the need to have transparent, equitable uses of health data. And especially now, it's more important in AI health applications. Finally, at the end of the day, after we get everything together and we've practiced and practiced and practiced, we got to put it before an audience. And that's our real world user and feedback. Because your AI isn't finished when it's deployed. It needs to be observed and adapted and tuned to the real world clinical workflows. You have to answer questions like, are clinicians actually using it? Are patients benefiting? This is the difference between a concert rehearsal and a live show. Let me ask you this. What's in your AI orchestra? Are your tools in sync, or are they just making noise? Now, if you're building or leading an AI initiative in healthcare, let's connect. I host AI leadership workshops where we turn those big ideas into actionable strategies. And if you're serious about building your AI roadmap, reach out to me today. Thank you guys for joining me here again this week. I'll catch you guys next week on the flip side.